Hi, everyone. I'm Fiona Danaher, Director of the MGH Center for Immigrant Health and a pediatrician at MGH Chelsea Pediatrics.
And my name is Rashmi Jasrasaria. I am one of the associate directors of our Center for Immigrant Health and a primary care physician in adult medicine at Chelsea Health Center.
So this week we've been hosting the 4th annual Migration is Beautiful campaign in honor of the United Nations International Migrants Day to celebrate our immigrant patients, colleagues, and friends, and to highlight the cultural richness that migration brings to our communities and healthcare system. Rashmi, what's one of your favorite things about working with immigrant patients?
As a primary care doctor, I get to see my patients over and over. And I think each time I meet them, I get to learn a little bit more about them and their migration history and their family. And I just appreciate how generous they are in sharing that and how grateful they are for kind of the care that we provide. What about you?
I feel the same way. I love that anytime I go to clinic, I'm going to learn something new. It might be a new Spanish word. It might be, a hot tip about good food in Chelsea. It could be a traditional remedy for something. But, even if I'm just seeing kids with colds all day, there's always something new to learn. And our patients are great teachers.
Totally agree. Additionally, we know that immigration status is a social determinant of health, and that language, legal, and cultural barriers can increase the risk of medical errors, especially with this patient population. How can we best provide the best possible care for this patient population, Fiona?
Yeah, well, I think you and I have both had experiences where our primary care patients come to us and say, I got this text from the hospital that I don't understand. I got this letter I don't understand, or somebody tried to explain something to me about my medical care, and I just don't really know what they were trying to tell me. So I think it's really important for everybody to remember that our patients always have the right to a professional interpreter. And it's really important to ask a patient's preferred language and not make assumptions. And then we should always be trying to offer an interpreter rather than relying on other staff or a patient's family members to interpret for them. Accessing interpreter services is pretty easy. We have an amazing interpreter services department at MGH. They're available 24/7 to staff. So if you're working out of main campus, here is the number. It's extension 33344. And you can save this to your phone. If you are at one of the health centers, they have their own interpreter services in many cases. So you can just ask your supervisor for the information to contact them. We also have access to the Siricom Interpreter app, which you can install on your phone, which is an easy way to connect with an interpreter on the go. And then in terms of how patients can access an interpreter, because if you think about it, a patient who speaks Spanish, if they're trying to call the hospital to check on a loved one who's inpatient, it's very hard for them to navigate to the right unit and communicate who they're trying to get to and what they want to know. So instead of them having to try to navigate that in English, there is a phone number that our patients with limited English proficiency can call to connect to an interpreter who will then help them reach the right clinic or the right unit. So during business hours, patients can call 617-726-6966. After hours in Spanish, and I know this isn't working very well, there is a 1-833-379-0351 number that Spanish-speaking patients can use. And a handout with all this information is also available in Apollo.
And we'll have it linked, hopefully, after this video. Yeah. That is super helpful. And, you bring up that obviously language is an important barrier for our immigrant patients. I often feel like it's more than that. Not only do they come to us saying they don't understand some of their, the care that they're receiving because it's not in the language that they prefer, but there's a lot of fear, especially in, the political climate of recent years, kind of for them to access care. And I think one thing that's really important to recognize here in Massachusetts is that our immigrant patients, even those that are undocumented, have access to some coverage for emergency and primary care services through Mass Health Limited and Health Safety Net. I was working within our residency program last year, and I often got questions, how can I make sure that I can get long-acting insulin or oral diabetes medicines or even COPD inhalers for my patients? And it turns out that if they have their Mass Health Limited, or at least an application is pending, and we send these kinds of prescriptions to a 340B or public pharmacy, then these patients can actually have access to anything that's on the Mass Health formulary. And our MGH outpatient pharmacy on Wang 1 and our Revere Health Center pharmacy both participate in this program. So it's been really helpful for me to be able to know that I can do meds to beds, get really important medications to my patients before I discharge them from the hospital, or if I'm taking care of them out in Chelsea. These patients can also see any specialist in our MGB health system. And sometimes it requires a little bit of advocacy from the PCP, but I've had my patients see our wonderful orthopedic surgeons, our subspecialty psychiatrists throughout MGH. And it's really helpful to know that, we all work as a team and that we all can care for these patients together. One thing is that sometimes discharging patients with Mass Health Limited can be challenging because they don't have access to rehab services or home health services. So I was wondering if you have a sense of, who we can call if we come up against kind of resource barriers or issues with healthcare access and discharge for our immigrant patients.
Yeah, so the Center for Immigrant Health is fortunate to have been able to develop a resource navigation program. And we have an immigrant health resource specialist named Marcia Burgos, who's a community health worker. She's absolutely phenomenal. So if you run into a situation where immigration status is posing a barrier to getting needed care or resources for a patient, you can email MGH Immigrant Resource at partners.org, or you can look her up in the phone directory under Immigration Resource Consult.
That's amazing.
Yeah. Rashmi, you mentioned fear as being a barrier to care. And on that note, I was wondering if you could comment about whether it's appropriate to document a patient's immigration status in their medical record.
Thanks for asking that question, Fiona. I am really careful and really cautious about what I document because our records can be subpoenaed by the court. So I never include someone's legal status. I never use the words undocumented or illegal. I will often include where a patient is from, like their country of origin and when they came to this country, sometimes in that social history box within EPIC, mostly because it gives me a sense of context as to what kind of exposures they may have faced or what their life has been like here in the United States.
Great. I also think that it's important for healthcare providers to know what to do if an immigration enforcement agent arrives at their setting. Healthcare facilities are considered sensitive locations by immigration enforcement. So we don't expect any enforcement actions to occur, but we do sometimes see ICE officers or officers from Customs and Border Protection bringing patients in for care who happen to be in their custody. So if that happens, staff can get understandably uncomfortable and unsure of what information can be shared and what the patient's rights are. It's not for us as individual clinicians to have to navigate these situations alone. So if this ever happens, you should notify your manager and then contact Police and Security and the Office of General Counsel. And you don't have to provide any information to any immigration enforcement agent unless Police and Security and Office of General Counsel advise you to. Rashmi, what should people do if they want to learn more about this topic or to get more involved?
So luckily, we're in the midst of Migration is Beautiful, a week where we promote diversity, inclusion, and celebrate our immigrant colleagues and patients. And we have been tabling outside of the cafeteria for the last half of this week. And we actually have these awesome badge backers, which you can add to your badge. That are available at the Employee Access Center, along with butterflies. As you can see, our backgrounds and this butterfly sticker here, which is the symbol of Migration is Beautiful, and that you can put on your badge to show support and solidarity with our immigrant patients and staff. Wonderful. Well, thank you so much. And if you'd like to learn more or get involved, please consider joining the MGH Immigrant Health Coalition. This is a multidisciplinary network of more than 200 employees. We're committed to promoting health and social equity for immigrants. This is our email address, MGH Immigrant Health Coalition, if you want to get added to our listserv. Thanks so much.